You are listening to the Marketing 32 Show with your host, Brett Allen.
Hi, Brett Allen here, host of the Marketing 32 Show, where I connect with leading dentists, dental influencers, and industry experts to uncover the latest and greatest to help your practice grow and thrive. This episode, as always, is brought to you by our team here at Marketing 32. We're the only dental marketing team with a performance guarantee that if you're not growing, you don't pay us. So we truly invest in who we work with, and we also ensure it's the right fit so that it's a win-win for everybody. So if you need help with growth in your practice, getting more new patients, reactivating old patients, all of that, reach out to us at marketing32.com, set up a quick discovery call. We'll see if it's a great fit for both of us. Quick shout out to Josh Rich from Clary, an awesome platform that helps you manage memberships in your practice. We had a great conversation about leveraging memberships, switching to fee for service and how memberships can help with that. All of that, super fascinating. Check out that episode. Excited to have a new friend of mine on the show today, Lisa Copeland, CSP. She is a speaker, coach, entrepreneur, two-time Ironman finisher, and firm believer that every conversation has consequences. She helps dental professionals stop playing small, increase team productivity, step onto bigger stages, and deliver messages that people remember long after the meeting ends. If team or audience influence is the destination, communication is the vehicle. I love that. Excited to have you on the show, Lisa. Thanks for coming on.
Thank you for inviting me. Great to be here.
Yeah, this will be good. So tell us your backstory. Walk us through how you got into dentistry and ultimately how you got into helping speakers and helping dentists deliver their message.
So I started as a hygienist, dental hygienist of 35 years. And the second job that I had in Washington, D.C., working for an implantologist, he was speaking internationally all over the world on dental implants because he was one of the pioneers that brought the technique into the U.S. And he came to the office one day and said, I'm teaching the dentists how to do these, but nobody else on the team understands what to do or what their role is. He said, would any of my team be interested in coming with me and teaching your aspect of dental implants? And I was like, let me think about it. Yes. And so I started working for a dental implant company with him. And started my presentation career, my speaking career. So I did that for years. And my husband and I met each other and we moved to Singapore. I couldn't practice when I was in Singapore.
Wow.
When I came back to the US, I started working for Philips. And they asked me to be an educator for them because I had the dental hygiene experience and the speaking experience. So I worked for corporate for 20 years as well. So it's kind of a trifecta of how I ended up having my own business and being a speaker coach. It was all of the things that I ended up doing in my career that came together.
Nice. Yeah. So going from hygiene to device sales, I bet that was interesting, and probably some things you've learned
really sales.
about. Okay. So yeah, on the education side.
Yeah.
Right?
So I was presenting to dental professionals. I was giving continuing education courses to dental professionals. So dentists, dental assistants, dental hygienists. And it was sponsored by Philips. And so they had this amazing professional education program.
That's great. So walk us through some of those things that you've learned in your career that have really helped you connect with people and help you influence people. Because I know speaking is all about influencing and helping people either make a decision or, learn something or something that's important. So what are some things that you've learned over the years that have been helpful in that aspect?
So I think one of the most important things that I learned early in my career was especially if you're talking to patients, like if you're in a clinical environment and you're talking to patients, taking a step back and having a conversation with them and really actively listening to their answers, because so many people are fearful of coming to the dentist, and what they say and what they really mean are kind of two different things. And you and I touched on this conversation earlier. It's like looking at the tip of the iceberg, right? And what we need to learn is what lies beneath. And so if the patient says, I need to think about it, they're probably saying, I'm afraid. Or if they say that's too expensive, maybe they're confused or they don't have enough information to get to a decision or to move forward. I'm too busy. That's another one you hear a lot because they don't trust you yet. And so having very realistic and heart-to-heart conversations with not only your patients, but your team members, so you're all on the same page and you're all saying the same thing, really influences your case acceptance and how patients refer to your practice. Do they refer to your practice, right? It all comes down to that foundation of communication.
Yeah, I think having an awareness to what's really behind, like the motive behind what they're saying, and helping uncover that
Yes.
hidden motive and speak to that is so important. What's been influential or helpful when you work with dentists or even speaking clients? What's been a tool or a piece of advice that's been helpful to, I guess let's stick on case acceptance. What's been something that has helped dentists that you work with have those ahas and figure out ways to improve case acceptance and getting their team involved, all of that?
Yeah. So first thing is really making sure every single person is saying the same thing. And, if they ask the hygienist a question or if they ask the assistant a question or the doctor, everybody's giving that exact same information back to the patient and answering those questions. Because as soon as we become confused, we don't take action, right? The other thing is when you're communicating, it's actually being very present in action. And so your tone and your timing and then your listening and your body language and your follow through, the patient is reading all of that. And so if your words are saying what the patient needs to hear, but you're thinking about the next patient or how far behind you are, or, what's going to happen at the end of the day, the patient's going to pick up on that. And so it's kind of a collaboration of everything. It's not just the words that we're speaking. It's all of those things that come together. So you have to be very present when you're communicating with your team and with your patient.
So walk us through some of those best practices when it comes to team handoffs and working and collaborating with your team to influence case acceptance. What are some of those things that the hygienist can be doing, or the dental assistant, or the front desk, and even at the end of the appointment? Like all of that really contributes to a patient saying yes and moving forward, right?
Right, right. And it starts with your first phone conversation, right? If a new patient schedules on the phone, it's that first conversation. Are you building trust, or are you answering the phone and saying, hold, please, and then putting them on hold for 5 minutes, right? So I'm a big fan of SOPs because I think you have to have just standards set up so that everybody's communicating together and really functioning well together. Because as soon as the team is off, the patient senses that. And so I love that you mentioned the handoff. If I'm the hygienist and I see the patient and then they're going to the doctor for a second procedure, using the other team members' names and introducing yourself and the next person that they're going to be seeing. So let's say I just finished a hygiene appointment. I'm going to take the patient back to the receptionist or the reception area and maybe talk to the receptionist and say, Carol, this is Mrs. Smith. She's going to be waiting in the reception area for her next part of the appointment with the doctor. Mrs. Smith, Ange will be out to get you in just a few minutes. When Ange comes out to get Mrs. Smith, she introduces herself, right? So she's heard the name twice. Hi, I'm Ange. I'm going to be working with the doctor today. We're looking forward to seeing you. Come on back and we'll get you started, right? And so everybody is, handing the patient off with intention versus just letting the patient come out to the reception area and the next process taking over. And that is a huge, very simple thing that we do all day, every day that makes such a big difference in the patient's appearance, right? In the appearance of how the patient receives the information.
Yeah. And are there other things that the team can do to really bolster the doctor or really kind of prime them to say yes to whatever the doctor recommends as in the best interest of their health, right? What are some of
Yeah.
these in the psychology of selling, what are some of these things, tonality that maybe could contribute and help that be smoother and easier for the patient? Do you have anything like that you can share?
Yeah, yeah. So if I'm working with the patient as the assistant or the hygienist, and maybe let's say I'm working as the hygienist, and I see that there's suspicious areas, so I'm going to mention it to the patient. I can't diagnose, but I can say, there's a few things I want the doctor to look at before he comes in to do your exam. Before he comes in and to do the patient's exam, I'm going to go talk to him and say, these are the areas that I think you need to really focus in on. So he comes in and reiterates the same information. And one of the areas where I see this falls through the cracks a lot is with periodontal patients. The hygienist talks to the patient about, you have periodontal disease. We need to do some scaling and root planing. And you kind of go through the whole process. The doctor comes in and does the exam and says, yep, this looks great. And everything you said to the patient just went, out the window. And so you have to really go back and forth to make sure that the patient's getting the same information from each dental professional, not just hearing it from one and then the other says, oh yeah, you're fine. That makes a big, big difference in how the patient perceives the practice.
Yeah, it has to be congruent and seamless. Otherwise, that's that could fall flat. What are some things that you've noticed have made like a really big impact when it comes to patient communication, talking with patients? What are I mean, some of these things we've talked about they seem almost obvious, but I'm sure there's a ton of practices that have room for improvement. But in your experience working with docs and their teams, what are the overlooked opportunities or things that really a lot of practices struggle with when it comes to communicating with patients?
I think one of the things most dental practices do is they speak in dental language, and the patient doesn't understand our language, right? We have quirky little language. Every profession has their own language, right? And we speak in dental terms and we don't explain it. We're not clear when we're explaining things to the patient. And if they don't have clarity, they are not going to move forward. So clarity really creates movement as far as a patient moving forward in any treatment process. And that's the area I see things fall through the cracks the most is we just, we're so tied to the clock and staying on time and making sure that we get everything done that we forget that patient has no dental background and they don't understand our language. And we really have to take a step back, slow down, pause, because the pause is the white space that gives people time to think. And then you move forward, ask if they have any questions. You've got to ask them if they have questions. Sometimes they'll say no, but a lot of times they will take advantage of that.
Yeah, I think that's important. You're hitting on some big things there where it can really make a difference. I think the language that we speak and the fact that an uncertain I forget where I first heard this quote, but an uncertain mind always says no. And so the more we can help our patients have clarity and understanding, like you said, I think the better. Let's kind of transition more into the work you're doing today. How did you get into speaking and working as a speaking coach? And what are some of the things you can share with those who are speaking at study clubs and, our specialists that are often trying to influence referral docs and things like that? Let's talk about that for a moment.
Right. So I started my speaking career and my clinical career coincided with each other. So I was working part-time and I was speaking for corporate Philips Corporation, and that paralleled for 20 years. And then I went off on my own. I created my own speaking business, Communicate with Influence. And from there, I still continue to speak in the dental industry, but I've moved more into speaker coaching. I've been speaking for 40 years, and I love the process of teaching people how to structure a presentation so that it, number one, creates action from the person, and you also engage with the audience, right? Because people don't hire a speaker for their expertise, really. They hire a speaker that's going to be memorable and the speaker that can connect with their audiences. And so I really enjoy helping people get there. So it's about the structure of the presentation that makes the people a great speaker.
Yeah, I've recently gotten into speaking. I've mentioned this before on the show, part of the Speakers Consulting Network, which has a lot of dental professional speakers in that group. You mentioned something about being memorable. That's what most event coordinators want. They want somebody that's going to wow and be memorable, right? What are some pieces of advice for me particularly? Help me out. What can I do to be memorable? What are some things that I can layer into my talk or my presentation skills?
Yep. So, think about the goal. The end goal is you want them to take action. And so that's what you start with. What do you want the people to walk away with and do? And that's where you start your speech. And then the whole thing is built around that. And so the goal really isn't to fill that hour. The goal is for what happens after they leave. that hour, right? And so a couple things you can do. Storytelling is a great way to just reveal a little piece of yourself and engage the audience. You want them to be able to envision themselves in your story or in your situation. And it's a great way to start. You can start with a quote, you can start with a statistic, you can start with a story. I tend to tell stories because I get my stories from my life. They're very easy for me to hone down into a 1-minute story and then relate it into the topic. And so the other thing you want to do is re-engage your audience quite frequently. And so if you're doing a 1-hour talk, you should not have any more than 30 slides, 10 slides every 20 minutes with no less than 30 font. And that's the killer. That's what gets everybody is the 30 font, because your slides are just there to support.
I've
They're
seen those
not there
presentations
for
where they're
you.
just putting everything in.
Yes. And you don't have very good engagement with speakers that do that, right? And so what's hardest for people, I think, is to take the most important information that you want to tell them and not everything that you know, and make it engaging, make it entertaining, and make it, I call it sticky. Make it so that they can remember it. And it can't be too much information or they won't remember anything.
Yeah, those are all great pieces of advice. I love the power of story. When I think back to those presentations or those talks that have really stuck with me or had an impact, it was relatable stories and I don't know what it is about us as humans, but stories really do create connection and they really help tie lessons together. And I love that you said that.
Yeah. And here's the thing. If you don't captivate your audience in the first 2 minutes, you're going to spend the next 20 minutes trying to re-engage them. And so your beginning and your end are the most important, with your ending being the absolute most important. Don't ever finish without an ending. I've seen speakers, they start running late and they start talking faster, and then they say, well, that's as far as we're going to get. So there was no call to action. There was no finale, and patients just leave and go, well, that was fine. Well, fine isn't memorable.
Yeah, for sure. And in fact, if you're coming in all flustered and not managing your time well, it's a total turnoff, right? Everybody else feels uncomfortable.
Right. Yeah, you got to control that.
Well, this has been awesome. Time is getting away from us. So let's end the show with the typical golden nugget that I ask everybody about. What's that one piece of advice in your life that's really been an epiphany for you? Could be about dentistry, could be about your personal life, speaking, whatever it is that could help our audience really have that epiphany and have that impact in their life as well.
I think my biggest lesson in both clinical dentistry and also speaking world is take time to establish relationships, because those are the bones. They're the support of how you're going to move forward with that patient, or how you're going to move forward with the team, or how you're going to create business from your presentations. Because every time you get up there and speak, it's an opportunity for multiple clients to come and work with you. It's just a matter of how you structure the presentation and how you deliver it. And so take time to create relationships in life in general, and it will get you a lot farther.
I love that. I have a saying that I want to try to add value in every relationship and give more than I take. And I think that speaks perfectly to that. If a relationship is about connection, and if you can't get beyond the surface and it's just very veneer, then it won't be memorable. There won't be any kind of influence or impact really beyond just the small talk that happens, right? And so I love
yes,
that.
I love that.
That's a great piece of advice. Yeah. Well, thank you so much, Lisa, for coming on the show today. If there's anyone who's listening and wants more help with case acceptance, or wants to hire you to help them with their speaking or their presentation skills, where do we send them?
They can go to my website, communicatewithinfluence.org. And my email is lisa@communicatewithinfluence.org. I'd be happy to work with anybody. And thank you for having me. This was great.
Yeah, absolutely. We'll put that in the show notes. So if you guys are driving, don't worry about it. Lisa's phenomenal, as you can tell. She's got a lot of expertise in dentistry and presentation skills, all of that. Team communication, communicating with patients. Definitely use her as a resource. Check out her website and engage with her for any help that you need. Thank you again, Lisa, for coming on the show.
Thanks, Brett.
All right, everybody. Until next time on the Marketing 32 Show, have a great rest of your day and a great rest of your week. Take care.